coming back to this idea of a paradigm shift. So, right now we hear from a lot of organizations that we have evidence-based services, we have motivational interviewing as part of our delivery system, and our nurses are using MI. But this is really a big paradigm shift for these nurses, and not only do they have to have that aha experience, they have to practice this. This isn't something that you just read in a book. You and I have talked about incorporating action learning components. Some of the work that we know from learning and development science is critical. That action learning by doing, using video resources as we're doing today, and other kinds of approaches, and actual vignettes with patients, is very important. And I know there are 100 other promising approaches that we haven't even thought of yet that we'll want to explore as well. Tell me about what it takes to learn motivational interviewing.
Well, I think that what you hit on there is that you have to have I think there's two components. And the first is that there's a lot about adult learning principles that really should be incorporated into the training. As you said, adults learn by doing. They learn, not just by observing, but by practicing and getting feedback. So that's going to be critical. The second component here is that we really are working with individuals to change their perspective. And sometimes this involves changing their perspective about their core identity, what their role is, and that can be difficult. Once they kind of get that perspective and they understand that the spotlight really needs to be on the patient, that we need to be in a partnership with the patient. We bring our clinical expertise to the table, but the patient brings their expertise in terms of knowing their life, their unique situations, the barriers, the challenges. And if we can accept the fact that by working together, that's going to be much more productive, then the rest comes easier. I like to compare learning motivational interviewing to learning to play a musical instrument or learning to play a difficult sport like golf. It's not something, unfortunately, that you can learn in a weekend retreat. You can be exposed to it and have a good immersion experience, but it's going to take follow-up. It's going to take the organization to put forth the effort and the energy for all of the other activities that really do help adults learn skills such as this.
Mm-hmm. So I think that's why it's so important. Some of the reinforcers that we've looked at in building mentoring programs, building this capacity inside of an organization to create a high-performance health coaching team, disease management team, is so critical to begin to make that part of the culture, because unless that's, that kind of philosophy is adopted within the workforce, it's very hard. If nurses feel as if this isn't the work environment, this isn't part of the culture.